Let's bring in the President, Association of Resident Doctors, LASUTH, Dr. Ojekunle Azeez. He joins me live via Zoom from Lagos. Good to have you join us, Dr. Azeez.
Thank you. Good afternoon.
Right. So, since you commenced or resumed the strike on Monday, and today, Wednesday, tell us what has happened so far. Has there been any form of dialogue between the federal government and the NARD?
Yes, again, thank you for having me. There's been a continued dialogue which had failed to yield the expected results so far since we suspended the strike some months ago. We've tried to explore the aspect of dialoguing, lobbying, advocacy, roundtable discussion, yet results were not yielded. And that culminated in inevitably resuming this suspended strike action. Here at the state level, we are having some dialoguing, which we are yet to accomplish to get our issues resolved, which entails the withdrawal of the circular that removed the cadre of our members from the scheme of service, the housemen, likewise the implementation of the Medical Residency Training Act, and the need for the recruitment, massive recruitment of the acute manpower shortage being witnessed currently, that's also contributing to the massive brain drain outside the country, among other issues. We are yet to have negotiation made and results achieved yet so far. And right now, the compliance is total and indefinite for the meantime, for now, across the nation.
So, Dr. Azeez, we cannot speak for whether the state government or the federal government, we cannot speak of the capacity to meet all your demands at the moment. But let's ask you, what are you willing to compromise at this moment? Or at what point would you say, oh, government has done this and this, so we will now resume or we will now call off the strike?
All the issues at hand are essential and very important to effective and seamless healthcare service delivery. However, we know some of them can be achieved within a short time, and some require some long-term intervention. What we need is the political will, the commitment, and of course, expected outcome, such that we can resume back at work as soon as possible. These are issues that are germane to effective service delivery. Some of our members in some other states are being owed 18 months salary, some over 9 months. Some salaries arrest, and the need for this circular to be withdrawn. Yes, it was issued at the state level, approved, referencing the similar circular that emanated from the federal government. But this circular is outrightly injurious to the healthcare service, and we are demanding for the withdrawal of that. Once we have these issues resolved, we can, of course, resume back to work with immediate effect. It's quite unfortunate that our patients are bearing the brunt of this industrial disharmony, and we look forward and plead to the government to yield to the plight in order to have effective healthcare service to the citizens.
All right, Dr. Ojekunle, like you mentioned, Nigerians are bearing the brunt. We cannot wait for these to be resolved amidst all of the health issues we're having at the moment. Thank you so much for talking to us. The President, ARD, LASUTH, Dr. Ojekunle Azeez.
Thank you for having me.